I'm Dr. Fiona Lovely, and this is the Not Your Mother's Menopause podcast. I'm taking the taboos of menopause and peri-menopause and bringing light to the dark. No bullshit, no shame. It's time for us to gain a new paradigm in female health, out with the old and in with the new, and I'm bringing fresh perspectives from someone in the arena. I've been practicing women's health for nearly 20 years, and I'm spilling the tea on what it means to live at midlife, knowing that the best is yet to come. I'm sharing my Gen X approach to living through this transition. Sassy, a bit sweary, and always honest. Tactical tips and instantly usable information is my aim. I hope to make you laugh and that you learn something new that helps you embrace the change. Together, we bring power to the peri. Onward to the podcast. Hello, listeners. Dr. Fiona Lovely here. This is the Not Your Mother's Menopause podcast. And thanks for listening. Thanks for tuning in. Thanks for sticking with me as I learn about my own peri-menopause journey, as I learn through my own peri-menopause journey, as I share what I learn with my patients and with you. And today we're talking about a very important subject, which is the Genitourinary Syndrome of Menopause. We're really just starting to understand this in an organized fashion. And so I'm going to share with you today what I've learned. But first, I want to invite you to consider whether or not you've ever thought, I wish I had the ability to help other women through their perimenopause and menopause journey, kind of like what I do with my people. And if that's ever been you, or you're a healthcare provider and you wish you knew more about what happens to a woman's brain and body, psychology at the menopause transition, then please consider joining the email list for the Menopause Doula certification. It is a program that I have completely created from the ground up, and we will be doing an information session in mid-November on it. Classes start in January 2026. As always, I say I'm so excited about it, and I am truly excited. It's like my heart pouring out onto the page. This is the work that's been the most satisfying of my professional career. And so now I can teach you to do it too. You don't have to be a healthcare provider. You don't have to have any medical training at all. Just come and learn what it's like to be a coach for women in the menopause transition, something I like to call the menopause doula. And you can join the wait list, the information email list at menopausedoulasociety.com. That's menopausedoulasociety.com. And we'll make sure that that is in the show notes for you. So let me take a brief pause and have you listen to words from our sponsor. Let's talk about something incredibly important, your heart health. You probably already know the stark statistic. Heart disease is the #1 cause of death in the United States. Now, it's widely understood that men develop heart disease earlier in life than women. But what you might not know is that this difference starts to change as women age. By the age of 65, women begin to develop heart disease at the same rate as men. Why does this happen? Well, the sources tell us that declining estrogen levels play a significant role. Estrogen has a profound impact on our cardiovascular system. It actively improves our cholesterol levels, keeps inflammation down, increases crucial blood flow around the body, and even helps to reduce damaging free radicals. Think of estrogen as a vital protector for your heart. It's important for our heart health, too, to take minerals. Certain minerals, such as magnesium and boron, are highlighted as being essential nutrients that our hearts and bodies need to function at their peak performance. When your mineral levels drop, it can lead to a decline in both your estrogen levels and your overall heart health. This is why I'm so enthusiastic about my partnership with Beam Minerals. They have formulated a fantastic way to make getting your daily electrolytes and essential minerals absolutely effortless. Forget about cumbersome pills or messy powders. Beam Minerals offers a simple solution. Just a small shot each day provides your body with the natural, plant-based support it needs. Ready to take proactive steps for your heart health and overall well-being? Head on over to beamminerals.com and don't forget to use my special code LOVELY to receive a fantastic 20% off your first order of Beam Minerals. That's LOVELY. Thanks, Beam. Okay, back with you again, and today we're talking about the genitourinary syndrome of menopause. And I would like to point you in the direction of the AUA, the Australian Urological Association guidelines from 2025. It's the AUA GSM guidelines 2025. If you do a Google search for that, it should come up. So this podcast is informed by that. And if your doctor gives you any kind of pushback, send them this paper, for heaven's sakes. So if you have experienced any of the following, stick around and I'll explain why and how you correct the problem. You're going to recognize yourself here quite likely, and there's a lot of really common symptoms on this list. So here we go. Vaginal dryness, painful intercourse or sex, painful sex, vaginal burning, irritation, vulvar itching or pain or irritation, the vagina being the inside parts of your sex organs, the vulva being the outside parts of the sex organs, narrowing of the vaginal opening, which you would know if, let's say, intercourse was painful, bleeding or tissue breaking during intercourse, urinary urgency or frequency, urinary incontinence or recurrent urinary tract infections, otherwise known as bladder infections, getting up to pee overnight, or painful urination. Maybe you've experienced reduced libido, difficulty with arousal and orgasm, fear of intimacy due to pain, or decreased genital sensation. If that is you, this is the genitourinary syndrome of menopause, what I'm going to refer to and what is referred to in the medical literature as the GSM. It is the spectrum of symptoms affecting the genitourinary tract during the menopause transition. And the menopause transition is like 35 to 55. There is some variation there. The most busy and symptomatic parts are in the mid 40s, kind of to early 50s. What we call late phase peri-menopause. And this is when you can really start to experience some of these things. The decline of estrogen and androgenic hormones like testosterone and DHEA make the tissues thinner and more fragile. So basically no estrogen means tissues decline. And here are the affected tissues: kidneys, urethra, bladder, ureters, vulva, vagina, clitoris, perineum, which is the space between your anus and your vagina, cervix, uterus, fallopian tubes, and ovaries. Basically, the loss of elasticity and moisture happens. There's an increase in the vaginal pH. The vagina is typically a very acidic place, and it shifts to more basic pH. The shift in the vaginal microbiome, which of course goes along with the pH. Labial atrophy, that is the inner and outer lips, if you will, of the vulva. Clitoral atrophy is also possible, and an increased chance of UTI. And if you have spent any time with a woman who might be elderly in her sunset years, maybe in a retirement community, you will know that the staff of the retirement community and or the doctors keep a pretty tight watch on whether or not a woman is experiencing a bladder infection, because when she does, not only are the urinary symptoms more significant, but also that bladder infection can quite easily move to the kidneys if it's not treated, and from the kidneys it can move to the blood, and that's called sepsis, and that is something you want to keep an eye on, because you can die from that actually without much difficulty at all. So we want to be treating bladder infections when they do come up. So this is one of the things that happens with the GSM. Now, up to 84% of postmenopausal women say they've experienced the GSM in some form or another. You don't get necessarily all of the symptoms, but you can have a variety of things off the list, as I've just mentioned. Low estrogen to the tissues can affect women at any age. So if you know a young female, someone in their reproductive era, who's had recurrent urinary tract infections and had multiple courses of antibiotics, she actually should be taking the low-dose vaginal estrogen, which is actually the answer for the GSM. Keeping estrogen in those tissues keeps them elastic, keeps them moist, keeps them functioning in a more agreeable fashion, if you will. And low-dose estrogen is essentially safe for every person. Now, obviously, your prescriber is going to be the authority on that, but it is such a tiny, tiny dose of estrogen. So I have heard it said that if you add it up, so if you use the vaginal estrogen every day for a year, 365 days, that amount of estrogen would add up to the estrogen that's in one single birth control pill. So ladies, this is a tiny amount of hormones. Nobody should be panicking over this. If your doctor or your nurse practitioner is saying something like this is not safe, then they are not well informed. Give them the AUA 2025 guideline for the genitourinary syndrome of menopause, or the GSM. So that is the solution to the concerns that you may have. Now, understand and be compassionate with yourself. These are taboo things. We were raised in an era where women did not talk about hot flashes, let alone the fact that their vagina is dry or they bleed during sex. So remember that you may be coming up against some societal beliefs here, and that's okay. Just be compassionate with yourself. Please do not sit in suffering with this. There are solutions and there are compassionate providers. So talk to your doctor about that. Now, as you know, when I record an episode, I'm always going to give you the stuff to do. So let's move on to that part of the podcast today. Talk to your doctor and ask for low-dose vaginal estrogen. It is safe for essentially everyone. Now, here's a little tidbit I'm going to give you. There is a prescription tablet that is often prescribed for women that are having painful and dry vagina. Now, I do not know who thought it was a good idea to stick a dry-ass tablet in a dry-ass vagina with a changing pH and think that that tablet is going to do what it needs to do. It's lunacy to think that's a good idea. Lunacy. So, please ask for the vaginal cream. There are prescriptions available. There are also compounding hormones available. That's what I use myself, as a compounded vaginal estrogen. And I can tell you that applying it feels like the nicest wrinkle cream you'd put on your face, except you're not putting it on your face. And please, by all means, ladies, get in there, get into the folds of the vulva, get the cream in there. If you have the vaginal dryness inside, or the painful intercourse, or the bleeding, etc., then you'll want to ask your pharmacist for an applicator so that you can put the cream inside the vagina. You will do that at night after you've finished all your late night ablutions and you are in bed, flat on your back, that's when you're going to insert that cream into the vagina, because then gravity is going to keep it there so that it does the things it's supposed to do. It will also help with pelvic floor issues if the muscles are experiencing the MSM or the musculoskeletal syndrome of menopause. Then giving a little estrogen to that area is also going to help with that too. Okay. All of those details are really important. I know that this is embarrassing stuff, but my God, there are over 1 billion of us going through this, and we need to be talking about it so that the younger generations, like, let us be the last generation that has to deal with this. Like, come on. If we have 10 different medications that are available by prescription, inexpensive, on how to harden a penis, then for God's sakes, we better have just as many solutions available by prescription or not that are inexpensive, easy to access, to make the vagina moist so these hard penises have a place to go. Nobody thought that one through. All right, let's talk about skincare, because as a doctor, I often hear the same frustrations from women. Many clean or natural skincare lines sound wonderful, but let's be honest, they frequently lack the ingredients that actually trigger real, visible change in your skin. And for those of you who aren't quite ready for the Botox route just to feel and look younger, what can you do to truly tackle fine lines, texture, and age spots? This is what I want to know too. Here's the truth about aging skin. A significant part of those signs you see, the dullness, the lines, is simply a buildup of dead or damaged skin cells. If we can genuinely improve how your skin efficiently clears out those old cells and regenerates new ones, we can actually reverse aging, not just mask it. And that's precisely where Young Goose Skincare comes in. They've done something brilliant. They've merged the best of natural skincare with medical grade science to create what they call biohacking skincare. This isn't just about surface level improvement. It's clean, it's remarkably effective, and it's designed to penetrate your skin barrier to trigger fundamental change right at the cellular level, helping your skin truly function younger. While other brands might talk about reducing the appearance of aging, Young Goose goes deeper. Their formulas are specifically engineered to reverse the signs of aging by targeting the root cause in your skin, delivering real results. Now, how do they achieve this? Of course, it's by leveraging powerful science-backed ingredients like NAD boosters. They're included to recharge your skin's cellular energy and support vital collagen production. Spermidine works to activate autophagy, which is essentially your skin's natural process of clearing out old or damaged cells. They use senolytics to help remove those aging zombie cells that can actually slow down your skin's natural regeneration. And their copper peptide complex with neuropeptides is fantastic for improving elasticity, firmness, and visibly reducing lines. They also include many more cutting-edge ingredients that boost your skin's regenerative processes. This isn't about a quick fix. It's about genuinely changing the way your skin functions. This means it can heal more effectively, regenerate consistently, and ultimately stay youthful over a long period. So if you're ready for skincare that genuinely works and delivers on its promises, I highly recommend checking out Young Goose Skincare. You can find the link directly in the show notes or go to younggoose.com/lovely. That's younggoose.com with code LOVELY for 10% off your order. I use these products myself, and I can tell you they make all the difference in the world. Check it out. Hi there, beautiful humans. This is Dr. Fiona Lovely, and I want to share something close to my heart with you. You know how we talk on the show about the isolation so many of us feel during menopause and peri-menopause, about feeling unheard, unseen, dismissed by healthcare providers who just don't get it, about wishing we had someone who truly understood what we were going through. Well, what if I told you that you could be that person for other women? I'm thrilled to introduce the Menopause Doula Certification. This comprehensive training program designed to prepare compassionate humans to support women through their menopause journey. This isn't just about hot flashes and night sweats. We're talking about the whole experience. The brain changes, the sexual health challenges, the emotional upheaval, and yes, even the spiritual transformation that menopause can be. Our core philosophy is, I see you, I believe you, and how do you want to feel? Because every woman deserves to feel heard, validated, and empowered during this transition. Whether you're a healthcare provider wanting to specialize, a wellness professional looking to expand your practice, or someone who's lived through menopause and wants to help others, this certification will give you the science-backed knowledge and heart-centered tools to make a real difference from someone who's been menopause doula-ing for 20 years. We are launching soon. Classes start January 2026. Visit menopausedoulasociety.com to learn more and join our information waitlist. Because the world needs more people who truly understand that menopause isn't something to just get through. It's a powerful transition that deserves expert, compassionate support. I can't wait to see you there. Anyways, and also accept, here is something I think was revolutionary when I heard somebody say it. It was Dr. Kelly Casperson talks about this on her You Are Not Broken podcast. Please listen. It's excellent. Maybe you're not interested in having insertion anymore. That's okay. That brings me to number 4 on my list of things you need to do. We'll go back up to 2 and 3 here in a minute, but this is a good segue. Talk to your sexual partner if you're having symptoms of painful intercourse, bleeding, lack of sensation, difficulties with orgasm, etc. Open communications to manage expectations is key. Make the necessary changes. And I know this stuff is not easy to talk about it. I get it. Again, maximal compassion for everything, for everyone, especially yourself. Have understanding for your doctor that might be learning about the way we can help a woman. But also, if you just plain don't want to have insertion anymore when it comes to sex, say so. Because otherwise, how would your partner know? The good news is there's lots of options. And please go and listen to the episode with Susan Bratton that I did in September if you need some suggestions on other options. Okay. So, low-dose vaginal estrogen to help with the GSM. Have a conversation with your sexual partner. Number 2, add in a vaginal probiotic. You can do this either an oral route or a vaginal route. Either way is fine. The vaginal route typically has like a cream probiotic in an ovule that you insert. Now, as I've just said, if you're really dry down there, don't choose that option. Okay, choose the oral option. And what that means is you're taking a probiotic orally, the bugs make their way through the gut, and then climb out your body at the far end of your gut and make their way into the vagina. I know it's gross. This is how it happens. We are animals after all, so this is how it happens. So a probiotic specific to women's health. Lactobacillus is one of the things you want to see, but there are other specific strains that will be in a feminine or female vaginal probiotic that you take either orally or insert it vaginally. And finally, I want to talk about what happens if you are experiencing the urinary changes of the GSM and it's affecting your work. It may be a good idea for you to speak to your HR department and or employer if you need work accommodations for more frequent bathroom breaks or maybe a different uniform because the uniform you've been given causes irritation of the vulva and vagina. Speaking up means if you don't say anything and something happens, then you wish you would have spoken up. It's the same thing with the changes that happen with our sexual partner and our sexual lives. Our reproductive lives are coming to a close, and now we get to navigate sex in a totally different fashion. And it may very well be that there are other things you wish to experience with intimacy, not just the kind that can end in a pregnancy when you are still reproductive, if you will. So again, we're renegotiating all the things. We're in a different era of our lives. We're embracing the crone, and we're making sure that quality of life, because it turns out women who experience the GSM have a decreased quality of life unless we can learn to manage it and talk to your doctor for a low dose vaginal estrogen. I hope this was helpful. Goodness, it was packed full of goodies. Let me know how you make out. As always, there's a form on drlovely.com that you can fill out, and those emails come right to me. So I'd love to hear from you. As always, thank you for the time. Thanks for listening to the show. Please follow me on TikTok and Instagram at Dr. Fiona Lovely, and sign up for the Menopause Doula newsletter, news list if you're interested. And if you're on the regular email newsletter list, which you can sign up at drlovely.com for, we will be talking about the Menopause Doula certification there too. Until next time, enjoy the autumn. I hope you're doing well. Take care. The information and other content provided in this show, or in any linked materials, is not intended and should not be construed as medical advice, nor is the information a substitute for professional medical expertise or treatment. We are doctors, but we aren't your doctor. Seek your doctor's opinion. If you or any other person has a medical concern, you should consult with your healthcare provider or seek other professional medical treatment. Never disregard professional medical advice or delay in seeking it because of something that you have heard in this podcast or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. The opinions and views expressed on this page and in this show have no relation to those of any academic, hospital, health practice, or other institution. Thank you.